So in this video, I'm going to talk about heparin versus warfarin. I'm gonna compare and contrast. This is one of the most famous Nclex topic that you must know before your exam, because this is most tested medication that will come on your Nclex exam. And Nclex exam writers, they cannot publish the Nclex exam without writing heparin questions. So you must know about your heparin warfarin. So I will try to make it simple, because a lot of students, they get confused when they see a question about heparin or warfarin or low molecular weight heparin. So I will try to compare and contrast both of them, and at the end of the video we're gonna do practice question and answer, and you will be amazed to see that you will be able to crack all of your answer immediately once we discuss about this topic, right? So the first thing first, I will try to explain you point after point, easy point after point, so you will learn that way. So what is heparin and what is warfarin? So they both are anticoagulant. They both are. So here is your first answer. If you, in your exam, if they give you heparin and comodine known as, then you're gonna say they are anticoagulant. So now you must be wondering what is anticoagulant meaning, right? So anticoagulant meaning that this medication will prevent further forming of blood clot. This medication will not break down any existing blood clot. You must know this. This medication will not break down any existing blood clot. Oh, so this medication is only gonna prevent forming further blood clots. That you must know. Got it? Again, this medication job is to prevent further forming of blood clot. You must know this. This medication cannot break down the existing blood clots. In order to break down the existing blood clot, then we don't need this medication. Then we need thrombolytics. So thrombolytic medication, that is the job of that medication to break down the blood clot. But this medication is only given to prevent forming further clots. It's not gonna break down the existing blood clot. Got it? That's the main point that you need to know. So the next thing is, in which condition do you have to give this medication? So the patient who are prone to develop deep vein thrombosis, pulmonary embolism, MI, myocardial infarction patient, post-op, post-operative hip and knee patients, and any patient who has heart valve replacement. So this medication, then it's given to those patients to prevent further forming of blood clots, because they're gonna be bed bound, right? So if not bed bound, then the myocardial infarction, what happened, the blood is gonna be pulling down. So there's chances that patient develop blood clots. So that's why this medication heparin and warfarin given to the patient who are prone to this kind of problems, right? You must know. Now I will do side to side compare and contrast with these two medication. So starting with heparin, right? So heparin, how you gonna give first thing first? What are the routes for heparin? So heparin is only given either IV or subcutaneously. Again, heparin is only given either IV or subcutaneously. If given to the subcutaneously, the only preferred site is 2 inches away from umbilicus. So it's 2 inches away from umbilicus. That's the only preferable site to give your heparin. You cannot give subcu here, or only 2 inches away from your umbilicus. So this is a question you may get in exam. So the best answer is going to be give 2 inches away from your umbilicus, right? Once you give this shot, you don't have to massage and you don't have to aspirate the heparin injection. That's the thing you need to know. This medication work very fast and is only given in the emergency situation. Next thing, the onset of this medication heparin is, this medication work very fast and given in the emergency situation. And this medication is only given for short period of time. So the next point is, the heparin is given for short period of time, short term. like you cannot give more than 21 days of this medication, but depend on your doctor or depend on your facility. But again, they have different facilities, different rule, but again 21 days you cannot give this medication more than 21 days, right? If this medication is given more than 21 days, then there are chances that patient may develop HIT. That's mean heparin induced thrombocytopenia. What happen in that? The patient platelets is gonna start dropping. So that's the concern for when you're giving longer period of time of heparin, you must know. Now I'm gonna talk about a little bit of warfarin. So heparin is only given sub-Q and IV, right? But warfarin is given only by oral route. So you have to give this oral route. The onset of warfarin is slow. It's gonna take around 5 to 7 days to show its effect in the body. And as heparin is only given for 21 days, but the warfarin can be given for the rest of the life. So this is for long-term medication. You must know about this. This can be given for long period of time, rest of your life. Now during your exam, if you get a question, can heparin and warfarin can be given in combination? So your answer is gonna be yes. Why the answer is yes? Because once you start heparin, heparin is given for emergency situation. It's like a fast acting, right? But once you're giving heparin, on the same time you're gonna give warfarin. Warfarin, as I mentioned, is gonna take 5 to 7 days to show its effect, right? So once the warfarin reaches to its level, then you can discontinue heparin. So, but your answer is gonna be yes, you can give this combined medication to the patient. The next thing is, lot of students, they get confused and they make a lot of mistake when they ask you about lab values, which one to monitor and what's the values. So when you are giving heparin, the lab value that you need to monitor is APTT and PTT. But during your exam, you have to select your answer as APTT. That's the lab value you have to select. PTT and APTT both are same, but APTT, that's the preferable to select your best option. And when patient is receiving heparin, the lab value should be 46 to 70 seconds. When patient is on heparin, the therapeutic range should be around 46 to 70 seconds. But again, depend on the booklets. Some of them, the ranges could be up and down. But 46 to 70, you must know, 46 to 70 seconds. And during your exam, if you see a patient is receiving heparin and the APTT value is 90 or 100, what's nurse gonna do? So first action, what you have to do, there are 3 things you have to do. If APTT value is like 80 plus, the normal is 46 to 70, right? But if APTT value is more than like 80 or 90, first thing what you're gonna do, you're gonna hold the medication. If you see that option, select immediately. You hold the medication, you call the doctor, second thing, and the third thing, you are going to give antidote for heparin. 3 things you have to do. Hold the medication, call the doctor, and give antidotes. So now the next question is, what is the antidote for heparin? So heparin antidote is, as I mentioned in my previous video when we were making antidote video, the heparin antidote is protamine sulfate. That you must know. Protamine sulfate is the antidote. And this medication can be given in the pregnancy time. Again, this medication is safe to give in the pregnancy time. When you are giving this heparin injection, what you have to do? You have to apply pressure for 2 minutes at least. When you are giving shot in umbilicus area, you have to hold the pressure for 2 minutes to prevent the bleeding. That is important thing to know. Now next thing is, let's talk about warfarin. So warfarin, another name of warfarin is, as you know, is a comodine, right? During your exam, they might give you warfarin or comodine, but both are same. When patient is receiving warfarin, the lab value that you are going to monitor is PT-INR. But forget about PT. The doctor is looking only for INR value. INR is very important. So that's mean you are going to select INR value. And the normal when patient is taking warfarin, the INR value should be around 2 to 3. It should be around 2 to 3. So again, if your INR value is like 4 during your Nclex exam, so you're gonna do same thing. You're gonna do hold the medication, call the healthcare provider, and then give antidote. Let's say if your warfarin level is 1, then what's gonna happen? So when patient is taking warfarin, the number should be in between 2 to 3, right? So that's mean 1 is very low. That's mean there are chances that the patient is gonna develop blood clot, because this medication is not effective and we want to see the range in between 2 to 3, right? But 1 is too low. So what's gonna happen? There are chances that patient is gonna develop what? Blood clot, right? And if the value is 4, what's going to happen? That's mean there are very high chances, if there is any cut here or there, the patient is going to bleed a lot, because there is no clotting factor to make a blood clot, right? So that's mean patient is going to bleed. So that's why the number should be in between 2 to 3. If it's 4, that means the patient is on high risk of bleeding, right? If the number is low, like 1, that means the patient may develop blood clot. So you must know. So that's why you have to check time to time their INR to see if they are in between 2 to 3, right? Right. Again, as I mentioned, if the range is high, you have to hold, call the doctor and give antidote. So what is the antidote for warfarin? Warfarin is same as comodine. So as I mentioned, you must remember CK clothes, right? Calvin Klein. So comodine means C and vitamin K, CK, right? Calvin Klein, CK. So vitamin K is the antidote for warfarin, you must know. And this medication warfarin cannot be given in the pregnancy time or those who are breastfeeding. This medication cannot be given in pregnancy time or if the patient is breastfeeding. So when patient is taking heparin, right, what are the normal thing? So pain, bruising, irritation of the umbilical side, they are pretty normal. You will see bruise, pain and irritation. So what do you have to do in that situation? You don't have to call the doctor, because that is expected thing. So during your exam, if you see this kind of question, the patient report having pain or bruising or irritation around the injection site, what nurse gonna do? So the nurse is going to educate the patient, that is expected finding, and then document in the progress note the patient re-educated about findings. On the other side, warfarin, you have to give this medication on same time, same day for better effect, right? And warfarin is not given during emergency time. So the next important point is what you are going to tell to the patient about the vitamin K intake when it's come to food. So you tell the patient you don't have to increase or you don't have to decrease the vitamin K rich food. You have to eat consistent amount of vitamin K as you're eating your meal. You don't have to add anything extra or you don't have to decrease anything extra. Tell the patient that you are going to eat consistent amount of food that you are eating like regularly, right? So no need to add or no need to decrease. The Nclex is looking for the patient when the patient is going to say, I'm going to eat consistent amount of vitamin K rich food as I'm eating my diet. So that's the way. So in which food the patient is going to get vitamin K? So they're going to get vitamin K from green leafy vegetables, spinach, liver and kale. Those are the important vitamin K rich food. Another important thing is vitamin K cannot be given to the patient who is already having deficiency of vitamin K. And also it's not given to the patient who has hypertension. Patient must have to have vitamin K in their body, otherwise the patient is going to have excessive amount of bleeding. Now the next thing is very important thing is I'm going to discuss about low molecular weight heparin. So low molecular weight heparin, exoprine, olovinox and heparin. So low molecular weight heparin, this is totally different than the regular heparin. So both has different function and different lab values, that a lot of students get confused. Enoxaparin, Lovinox, known as low molecular weight heparin. So don't confuse between heparin and enoxaparin. So what is the lab value you have to monitor when you're giving low molecular weight heparin? So you have to monitor for their platelets level. You're not gonna monitor for APTT or INR, but you're gonna monitor for platelets level. So the normal platelets are 100,000 to 400,000, right? If platelet is less than 150,000, then what are you gonna do? You're gonna do same thing. Hold, call, and give antidote. What is the antidote for low molecular weight heparin? Is same as heparin, protamine sulfate. Another important thing is the regular heparin and enoxaparin, they cannot be given in same combination. They cannot be. They both have different responsibilities. Only heparin and warfarin can go in the combination, but heparin and low molecular weight heparin, they cannot be given in the combination. Another important thing is if the patient H and H level is low, then don't give heparin and enoxaparin. H and H means hemoglobin and hematocrit. If the both levels are low, then don't give heparin and enoxaparin. So what is hematocrit? Hematocrit is the percentage of the RBC in the blood. You must know that. So when hemoglobin and hematocrit both levels are low, then you don't give heparin and Lovinox. Now another thing, with the heparin and warfarin, you don't give any OTC NS8s. You don't give any OTC NS8. You don't give, with heparin and warfarin, you don't give aspirin, you don't give clopidogrel, because they both are blood thinner, right? And also another thing is, if patient is taking antibiotic, that is also contraindicated, so you don't give antibiotic as well. You tell the patient no alcohol base mouthwash. You tell the patient water based mouthwash, they are okay. And you tell the patient don't participate in contact sports. Contact sports are like hockey, boxing, or cricket. Anything that can cause cut, you have to avoid the contact sports, right? Also, you have to remove the throw rugs. The patient room should be well lighted, and in the bathroom the patient should have grab bar, so there is no chances that patient is gonna fall in the bathroom. You also tell the patient no razor, but you have to use electrical razors. No real razors, but electrical razors, they are okay. Also, you have to tell the patient to use soft toothbrush, no hard toothbrush, only soft bristle toothbrush, they are okay. No flossing at all. So another thing is, this medication warfarin and coumadin, they are contraindicated in the patient with hemophilia, aneurysm. Aneurysm means there is a rupture of blood vessel, and the patient who has peptic ulcers. So when they say this kind of problem is present, then you don't give heparin and warfarin, because there are high chances the patient is gonna start bleeding. And one of the famous side effect, classical famous side effect of warfarin is long term, because you are giving long term, so patient is going to develop osteoporosis. That's the classical symptom side effect of warfarin. Patient is gonna develop osteoporosis. So that's the wrap of our heparin versus warfarin and low molecular weight heparin. So now we're gonna discuss, we're gonna do practice question and answer, and you will see, you will be able to crack most of your answer immediately. Right, let's start. So due to the long length of this video, will not be able to do the practice question and answer, but on our next video we will do practice question and answer. So good luck to you guys.